This open meeting of the Triton Regional School Committee is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, and the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the virus, we've been advised and directed by the Commonwealth to suspend public gatherings, and as such, the Governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. I hereby call to order the October 1st meeting of the Triton Regional School Committee and the District Communication Committee at 6:30 p.m. I'm Narissa Wallen, Chair of the Triton Regional School Committee, and I would like to confirm that all members and persons anticipated on the agenda are present and can hear me. So we'll just go through the list, I think, of everybody that's here, because it's a relatively small list. So Caitlin.
I'm here and I can hear you.
Thank you. Kim.
I'm here and I can hear you.
Thank you. Joe.
I'm here and I can hear you.
Thank you. Paul Mayette.
I am here and I can hear you.
Thank you. Kyle.
I'm here and I can hear you.
Thank you. Paulise.
I'm here and I can hear you.
Thank you. Larry. He's here. I'm assuming he can hear me. Just not sure he can talk.
Present and audible.
All right. Thank you. Neil.
I'm here. I can hear you. Can you hear me?
Thanks, Neil. Linda.
I'm here and I can hear you.
Thank you. And Alicia.
I'm here and I can hear you.
All right. Thank you. For this meeting, the Triton School Committee is convening remotely via Zoom using the information posted on the district's website, identifying how the public may join. If you are personally attending by video conference using your device's camera, please be aware that others may be able to see you. Committee members and administrators, please remember to mute your phone or computer when you are not speaking. All supporting materials that have been provided to members of this body are available on the district's website with the agenda posting unless otherwise noted. The public is encouraged to follow along using the posted agenda. Each vote taken in this meeting will be conducted by a roll call vote. Please note that this meeting is being recorded and that anything that you broadcast may be captured by the recording. All right, so we all know each other, so I'm going to assume that we don't need introductions tonight. I don't think there's anyone on here that's new that we haven't talked to before. So the first thing on the agenda is meeting notes. It's the notes from the September 17th, 2020 meeting that were included in the agenda packet. As you know, we don't, these aren't technically minutes, they're just notes, so we can take edits if need be, but we don't actually approve them. Are there any edits that are needed for the September 17th meeting notes? All right, seeing none, I will move along. Triton Fall reopening update is the next item on the agenda. So we have Kim and Kyle are going to talk a little bit in a minute about reopening schools, but to just recap last night's conversation real quick, as you're probably aware, there are checkpoints that are built into the Triton schedule as far as the reopening plan goes. So periodically through the fall, there are set to be checkpoint dates, and then there's a following reopening date, so that if the model is changed, that would be the date that it reopened on. So the first checkpoint that was in there was September 30th, and that would have resulted in an opening of October 13th. We did have a very close vote last night, 5-4 split vote, that resulted in the district remaining in remote. We are doing some follow-up on that because it was a long, late meeting, and I think there are things that I personally would love to hear more about as far as what was discussed last night that we just didn't, I don't think we felt like we had time for at the point when we were running at 11:15 and after starting at 7. And I know that's true for others as well. So we are tentatively set to meet next Wednesday again. That would be the 7th of October, and there are members that are doing school tours, which is was one of the other requested items. Those tours will be, the school committee members will be going on those Monday, Tuesday, and Wednesday next week at their convenience, so that they have a chance to see social distancing in the schools and what it looks like with the high-risk students that are in right now. So I know this was covered in the past, but well, the majority of our students are remote full-time. When we have a set of high-risk students, those could be students who are on IEPs, it could be students that are homeless, it could be students that are English language learners, those that would have extremely difficult time learning remotely, who are actually in the district schools right now. And we have staff in there that are supporting them. They are following all our pandemic policies. We have a number of pandemic policies that we instituted. 6-foot social distancing is included in those. Full masks are included in those unless there's a medical reason that they cannot wear a mask, and there's some pretty stringent guidelines around what would qualify for that. The cohorting, all that type of stuff is already in place. So it's kind of a microcosm of what it would look like if the district opened in hybrid. So that's the plan moving forward. We have been doing a lot of work in the background. So I'll come back to testing and contact tracing at the end, but I know one that I thought would be of interest for you would be the ventilation study, which I'm gonna turn over to Kyle because he has a baby, but this is also his other baby.
Well put.
I don't
yeah.
know which takes more of your time, Kyle.
The other thing I'm always thinking about. Yeah. Thank you. So quick background on the process we've gone through so far. Early on in the summer, when it became apparent the airborne risks associated with COVID-19, we met with a set of industry professionals, HVAC system industry professionals, as well as the mechanical maintenance providers for our HVAC systems, to discuss with them what are the best ways to mitigate the airborne risks of COVID-19 in our school buildings. Across the board, the consensus was increased filtration and increased airflow. For increased filtration, we looked at the filters that are being used in all of our HVAC systems. They're all on it's called a MERV rating. Basically, the lower the number, the less filtration, the greater the number, the greater filtration. They settled on MERV 11, which had the best balance of filtration, yet not inhibiting the airflow as much, that would be preventative yeah, I'll stop there, getting a little caught up in my words. So we went with the MERV 11 filters. We purchased those. We've received those and installed all of them. Regarding the airflow, we are opening up all our windows. We took a look at every single room in the facilities to make sure those windows were operational, with the exception of extreme weather. We'll make sure to keep those open as an added layer of assurance. We've looked at all the systems and opened up the dampers, making sure, while it may not be the most efficient way to operate these HVAC systems, because we're constantly heating outside air, drawing in that outside air through the systems only helps our scenario. And then also, we needed to make sure that these HVAC systems are running properly. The best way to do that is we contracted with an outside engineering firm to take a look at the air exchange in every single room of each of the campuses. And so what they actually do is they walk around in the room and they'll look at the exhaust, the air being pulled out, and then the system that's pulling the air in as well. And they meter those with like a hood type device. And the goal, or the industry standard, is a minimum of 4 air exchanges per hour in each of the rooms. So the engineering firm came out in the month of August. They actually finished on August 31st, provided us with the results shortly thereafter. There were a number of rooms that were found to be below that 4 air exchange per hour rate. We immediately got on the work there. We contracted with an outside vendor to repair any of the systems that were not functioning properly or were non-operational or just not running as efficiently as they could. There's certain ones where there was some dust or particles, things like that. So we remedied all of the issues, and then we brought in that same firm. We brought them back in to re-meter those rooms that were found to be deficient. And that work is ongoing because of unfortunately, every other community in the state is asking their facilities departments to do the same project. So it's been challenging, but we have them coming back out to wrap up this work this coming Monday and Tuesday. But in the interim, we did want to get a sample of rooms done, remetered at each of the buildings, and the results have been very encouraging. At the middle school, high school campus, out of the 34 rooms remetered to date, 30 are now over that 4 air exchange rate per hour. At Salisbury Elementary School, 16 of the 17 rooms remetered are now above the 4 air exchange. And then at Newbury Elementary, 7 of the 7 remetered are above that rate. Worth noting, Pine Grove School, we did not include in the scope of this engagement, where that's a brand new facility. And actually in February of 2020, there was as part of the certification of the building, there was an engineering firm that certified each of the HVAC systems to make sure that they're up to spec. And part of that process was reviewing the airflow. So we didn't feel that it was worthwhile and the industry professionals and our mechanical maintenance providers agreed in that it wouldn't be worthwhile to include that in the scope of the engagement. So we'll certainly be following up with school committee, but our sense is that all of these rooms will be in good standing. And as a contingency plan, because the aging HVAC systems in our building, they're going to go down. They're 20 years old. We're having our custodians continuously, sorry, it's been a long day, continuously take a look at these systems to make sure they're not offline. If they are, our plan is to close off that room. We'd shift over students into another space. And we also have a portable HEPA filter, which essentially performs the functions of those HVAC systems. We'd wheel that into the room, and then that'd provide an added layer of air filtration. So any questions there on an update?
Well done.
Thank you.
Thanks, Felicia.
And I would like to say hats off to our facilities director, Chris Walsh, the custodial and maintenance crews at each of our buildings over the last few months. They have been working tirelessly to bring all our systems up to speed. So thank you to them.
Actually, I do have a question. Where is the money coming from to get all this done? Is that coming from the CARES Act?
So right now we're charging the general operating fund. We have 3 pools of federal grant money. Trying not to get too long-winded with this, but one of the pools we can only use for remote learning technology, so not qualifying there. Another one, the CVRF, COVID relief funds, that's the $512,000 bucket of funds. It is specifically noted in that we can't charge deferred maintenance to that account. So we could charge the air filters, which we most likely will, because we would have never purchased that high level of a filter unless we were battling this pandemic. But in terms of systems going offline or repairs, those are considered deferred maintenance and we can't charge that fund. The third pool of money, the CARES Act or the ESSERF grant, we could. However, right now we're including that in our general operating budget because we feel like we have some budgetary capacity there. Also it was back in the June school committee meeting, we were talking about $512,000 worth of deferred costs and cost savings. There were some 5th and 6th grade teachers at the elementary schools who had retired that we aren't going to be replacing. So those cost savings will offset these added costs. And to date, it's been about $125,000 that we've committed to spending on these repairs for the HVAC systems.
Thank you.
Yep.
I think it's worth noting too that we are charging a lot of things to those pools that Kyle mentioned. So PPE, I believe, right, Kyle, is coming out of there. Chromebooks?
Correct. So
I'll let
right
you-
now, yep. So we have the Chromebook one-to-one program that's being charged to the Remote Learning Technology Grant, the $512,000 bucket. We costs associated with facilitating remote learning. We were charging those to the grant. Special education, where there's been potentially compensatory. I always mess up that word. Sorry. Services.
Compensatory.
Thank you. I'm going to have to say it 19 times. So special education costs, instructional costs, and then facilities costs, such as, like Narissa mentioned, PPE, the engineering study to take a look at all the HVAC systems, that's being charged there. And then the remaining pot of money is also going to special education as well as our Chromebook program as well. So we're kind of looking at finance. I'm getting a little long-winded here, but at finance subcommittee yesterday, we went over all of these those three pools of money, the state of our general fund, and to making sure that we're in good standing. And we feel right now we're navigating this the best that we can.
Yeah, thank you, Kyle. So I should have said in the beginning, Brian sends his apologies. I'm not sure if he emailed that out, that he couldn't be here tonight. So in his stead has come Kim Croto, our assistant superintendent. So as you're probably well aware, the prime focus for the beginning of school, given that we're opening in remote, has been the remote platform that we've all been working on. So again, the majority of our students are using tools like Google Classroom and Google Meet to receive instruction from their teachers and assignments. The latest project in this preparation for moving to hybrid has been this kind of separation. So the state's requiring us to provide a remote instruction to students who prefer to continue it. And then the district will have a primary model. And when that model becomes hybrid, obviously there's going to be a heck of a lot more moving pieces to this than there even is now. And right now I can say there's already a lot. So Kim's going to talk briefly about kind of that work that's been going on in the background so that you have an idea of sort of what kids will be experiencing as we eventually move into those models.
So in the hybrid model specifically, we will have the teachers primarily focusing on the students who will be in front of them. And the students will be divided into two cohorts, A and B. The cohorts allow for a reduced number of students in the classroom so that the transmission rate is less. So as one cohort is in the classroom, the other cohort will be outside at home participating in remote learning, with the majority of the activities being asynchronous, which means that they are self-guided, they are independent of what is happening in the classroom. I think the biggest thing that we learned along the way is that our original hybrid plan of having the teachers the majority of the time live streaming lessons to the kids who are at home, realizing that that's really not the best instructional mode, just because of the challenges with kids being able to see the board, the position of the camera, even just the audio with a mask over your face. So we have heard from numerous districts who have started through their remote, their hybrid settings, that it is not going as well as expected. Now, with that said, I feel that our hybrid will certainly have some challenges when we move. There are certainly a number of teachers who, because of their own medical concerns, will potentially be taking some type of leave. So those openings will be challenging to fill. As far as instructional practices, I feel like we have certainly I wouldn't say perfected, but we have strengthened our remote learning environment since the spring. And I believe that will continue to develop when we go into hybrid. And they will shift, like I said, most of their focus on the students who are in front of them. The expectation, though, is still going to remain teaching a full year curriculum. We know that that is a lofty goal, and the likelihood of that happening is probably slim, but for us to at least set that as a goal and continue to talk about where we are within the pacing of the curriculum, I think will be really important, so that as we move into the following year, we can adjust as necessary. So that was, I would say, one of the biggest developments, just making sure that people understand that the original picture that we had intended with our first reopening plan, it will certainly not be that, but that's not to say it will not be a positive experience for the kids. And I think just the other piece is that the learning environment, of course, is very much different. I think a lot of kids are hoping to go back and socialize with their friends and have lunch together. And Narissa spoke a little bit about that, just giving people a really clear sense of reality of what it will be like when we do go hybrid. So certainly a lot of things to consider and to continue to plan for and support. I guess along with the hybrid plan being revised is the fact that we also have to plan for a group of students who potentially cannot participate in that hybrid model because they themselves have some health issues or their family members. So as a district, we need to provide a full remote model for them. We have sent out a survey to find out the interest of this particular model. And I would say the majority of families are from the elementary level. And then second to that is the high school. Middle school had very few families who needed that type of accommodation. So in looking at those numbers, we are going to potentially collapse some of the elementary classrooms that are in existence right now. And the ones that we will collapse are ones that have probably maybe around 14 or 15 kids, maybe even 12, based on the students who are exiting going into that remote model. Those teachers will then become the remote teacher for that particular grade level. And there would be one teacher per grade level per district. So it's not one teacher per school. So there's no additional cost to run this separate remote model. It will be certainly an inconvenience for people, especially obviously the kids who have already met their teacher and developed some relationships, but we are hoping to do that sooner than later and not wait for the hybrid model to begin, because we are concerned that the transition will be much more difficult for those kids if we don't do this earlier. So looking into that, and the survey, like I said, closes tomorrow, and we pretty much already have a timeline established that could possibly move that remote model into play as early as, I'd say, the middle of the month, so around October 13th, 14th, 15th. So I think that's pretty much a very brief update around the hybrid and also around that full remote model option that will be available to families in a few weeks.
Thanks,
Any
Kim.
questions? Yep.
Questions for Kim? And I should add too that obviously the social has been and mental health has been a big concern around here. So a lot of the schools are working to provide after-school activities, those things that really motivate students to kind of be involved in schooling itself, and they're planning to offer a lot of those virtually, and there is actually a virtual open house tonight, which is why we don't have any of our high school parents on here. They're actually all at the high school virtual open house tonight, so that's why Paul was in here and then ducking out quickly, because I'm sure he had his first period class waiting for him. So that continues to be ongoing as well. A quick update on testing. We've been working with Anna Jake's Hospital. I know this has been kind of a point of discussion in the past. Working with our legislators, trying to do some work to bring down testing times, make testing more accessible. So Anna Jake's was initially a bit of a difficulty with minors. A lot of what was happening with minors is because there are limited testing locations for them in the area, they would have to go to the pediatrician, get a referral. The referral was generally through Anna Jake's ER. They would get tested through the emergency room, and then it was at the time that we voted our original plan back in August, it was an 8 to 10 day wait before they got results turned around on that. So extended period of time. So I can't say that it was all us, although I know we've been pushing pretty hard. But they have now moved all their testing, except for people that are going inpatient or for surgeries and things like that, urgent surgeries. They've now moved those out into there's basically a tent in the parking lot that's open, so that we don't have, I mean, I can tell you the largest number that I've seen is Monomoy Regional had a student that was positive, and it caused 80 close contacts. So these can be significant when we're talking about how many people it can be involved who need to go get tested and be isolated afterwards. It's not a small number. Most of them are smaller than that. I know there was one at Newburyport that I believe, was it 25? I don't know. Paul Mayette, do you remember the number? I think, was it 25?
5 students and somehow 10 staff, which
Okay, all right, so it's 15, yeah. So generally they'll be smaller than that. But that was definitely a concern. Anna Jake's is currently turning around their normal testing, so not the rapid testing, but regular testing, which is what most people would get, in 2 to 3 days right now. And they have either insurance coverage, sometimes with a small copay for a referral if there's a referral required into the tent. And they're covering students with, or anyone with Mass Health, and they are also covering those who do not have insurance. So that's been a tremendous step forward since in the last basically month and a half. So I would like to thank our contact there, Gary Lee, who has been working with Brian on that. He's, I think, the VP of Clinical Labs or something like that, and he has been great about letting us know kind of what's going on and where improvements are and things like that. And then definitely our legislators as well, because we've been putting in calls to them. And I know we're not the only ones, because I always have this conversation with them that say, yep, students need testing too, because we could literally affect everyone in the community. So I know other groups have been contacting us as well about trying to get those times down. Contact tracing, you may know more than I do, but I'll rehash what we learned from Newbury's health agent last night. And I will say thank you to all of you, because this was an issue that we brought to this DCC probably a month and a half ago now. And Deb Rogers from Newbury, the Newbury health agent, stepped forward and took on kind of this project of looking for coordinating volunteer contact tracers. The district did an enormous outreach on this to try and reach into our parent communities, into our social media communities, to try and bring in volunteer contact tracers that, if there's an issue, could be called upon to help with tracing. And as of last night, there were 31 individuals that had actually volunteered to be volunteer contact tracers, which is a huge step forward, given it was a half-time public health nurse in each town prior to this. And Deb let us know last night as well that the 3 towns are working together to hire a I'm not sure what her exact title is. I believe she's the school contact tracing coordinator. So this is a hire that will be working with the town health departments and also with our school nurses, and will essentially be that coordinator to make sure that as we either have cases that become known to our schools, make sure that there's coordination with the towns to make of residents, so that those contacts and the cases can be tracked appropriately, and also the other way. So if they're notified through Maven, the state epidemiology system, of a positive case. They'll actually, if a student, for instance, or a staff member hasn't notified us already, then they'll be able to pass that information back and forth. We'll work together to isolate the contacts for any positive cases, and then that contact tracing will happen. And I understand that the new hire, the coordinator, will be also coordinating with those 31 volunteers who are going to be doing the volunteer tracing. So I believe Deb said that she is the coordinator is training this week and coming on board on Monday. And since she's working primarily with Deb, Deb is going to work on whichever case they get first from either Newbury or Georgetown, since Deb also works with Georgetown, to kind of give her first case and walk her through the process. And then she'll also be, of course, reaching out to all the people that she's going to need to coordinate with for contact tracing down the road. So I think I believe I remember saying the very first time we had a conversation about contact tracing, like, I'm not expecting you to hire anyone. This doesn't have to be a full-time position. And then I think as the scope of the contact tracing that could be involved in having large numbers of students in our buildings at once became evident, obviously there was a plan made, and I think this is, Deb said it last night, like she's very confident that once this coordinator is in place and all those volunteer contact tracers are trained and in place, that they will be able to meet the capacity for any school tracing that would be required. So thank you very much for that. I appreciate it. And I think that was the entire update that we had. Let me see if there's anything else in my notes.
Narissa, can I ask a question about that contact tracing?
Yes.
So I read in the paper that there was a Triton athlete that was positive.
Mhm.
Did this program or this support system that Deb Rogers put into place, did that start working on that, or was that handled otherwise?
It was, so my understanding is it was handled between our nurses, Deb, and one of the other health agents of the town of residence, because that coordinator was not in place yet.
Okay, thank you.
But yeah, they did it was relatively quickly, I can say. I was notified that there was a case and that they hadn't, they couldn't make it public at that point because they had to notify everyone. And they very quickly determined who needed to be notified, made the phone calls to those close contacts, and at least within, our athletic program. And then had an email that went out and notified all of the middle school and high school, because those are the grades that could be involved as far as close contact, those two entire communities that there had been a case, that case, that any close contacts of that case had been notified already, that people should monitor themselves for symptoms as they always would, but if they hadn't been notified, that they would not be considered a close contact at that point. So.
Great, thank you.
Yes, it was, I hate to say, you have to test every system, and I would much rather have kind of tested it this way and seen it go well, than be facing, all of a sudden having 5 cases a week into having kids in hybrid, and having to test the system that way. So all in all, I think from what I understand, I can have limited knowledge of it because of HIPAA, but from what I understand and from what the health agent said last night, it was fairly smooth, especially for our first case in a system that had not been tested yet. And I think it'll only get better from here, especially when Kristen, I believe is the name of the coordinator, actually comes on board and is kind of that full-time contact, sort of pulling all of the systems between the towns, the volunteer contact tracers, and our school nurses together. So,
Very good, very good.
thank you. Any other questions? All right. So we don't have another DCC date on the books. My suggestion at this point, I guess, would probably be to put it out a month, like we normally would, unless anyone has any other ideas about needing to meet sooner than that. That would put us, I'm just going back into my email to grab my calendar. So that would put us, I guess it would put us in the beginning of November. So if we were looking for another Thursday night, probably Thursday the 5th would be a good night to meet. That'd be November 5th, or we could pull it back 1 week and go to October 29th if people would prefer. I think we can finally relax back into that once a month meeting schedule. Is
Well,
there any
when's the school committee meeting again?
The school committee is tentatively meeting next Wednesday. I need to make sure I have a quorum for that because that's going to be a meeting that we haven't had on our books. Our business meeting for the month is the 14th. And then our checkpoint meeting for this month would be the 28th.
So do you think there's any reason why we would need to meet before next month?
I don't think so.
Okay, then
You wanna
I'm good
move-
with the 5th.
The 5th.
So
Any
that's
other-
just me. You can ask Raleigh and Salisbury too.
Anyone have any concerns with the 5th?
I have no concerns.
Okay. Thanks, Joe.
I'm
All
not
right.
available on the 29th.
You're not available on the 29th? How about the 5th, Neil?
Yes.
That works? Okay. Let's go with the 5th at 6:30 then. And I can say we're kind of nailing down things as we go, so I'll try to make sure that we're kind of giving you an update of, you know, kind of where we're at now and where we're at then. Things are getting, I think, more, we're doing more work, obviously, with the grants, so we may have an update on, you know, further work that's done there. We'll definitely have the ventilation, which, given that some of these are your buildings, I'm assuming, again, that you're interested in. The ventilation wrap up, the last re-metering should be done by the 6th, so we'll have the final report, and we're actually going to publish that final report when we get it. So we can actually make sure you get a copy of that too, so that you have the records for Salisbury Elementary and Newbury Elementary. Again, Pine Grove, because it's so new, was the words were anyone else would be jealous of those air exchanges, I believe, was the way it was put to me, because they are very efficient systems. So we'll have that information that can go out to you in between, but we can go over any updates from that at that meeting. And then I am sure, given the rate that things are changing, that there will be more updates throughout the month. So, so we can update you on those as well at that point. Any last minute questions, concerns, comments? All right, excellent. Well, thank you for your time tonight. I appreciate it. I know it's just a quick time to catch up, and I'm, again, sending Brian's apologies and anyone else that was out at the high school or had any other conflicts tonight, because I know there are a lot of them. We've been, unfortunately, meeting a lot, which has wreaked havoc with people's work schedules as well. So, so again, thank you, be well, and we will talk to you all soon.